Okay, so when you think about breathing problems, what's the first thing that comes to mind? Your lungs, right? Of course. But what if I told you the problem isn't always in your lungs, but in the tiny, crucial space around them? Today, we're going to dive into what happens when that space gets filled with fluid.
Yeah, think about it. We spend so much time focusing on our lungs themselves, but we kind of forget about the delicate environment they live in. And when that environment gets disrupted, when it gets flooded, that's when you run into some really serious trouble. This is the whole idea behind a condition called pleural effusion. All right, so let's get right into it. What is pleural effusion? At its core, it really just boils down to one simple thing: too much fluid in the wrong place. We're going to see how this normally tiny, super helpful space can suddenly turn into a huge problem. So, you're probably wondering, what the heck is the pleural space? Well, imagine this. It's a super thin gap between the outside of your lungs and the inside of your chest wall. Now, normally, a tiny bit of fluid seeps in from capillaries to act as a lubricant, letting your lungs move smoothly. Then your body's drainage system just whisks it away. It's a perfect little system. Pleural effusion is what happens when that perfect, delicate balance gets completely thrown off. To really get a grip on this, you first have to appreciate just how little fluid is supposed to be there normally. We're talking 1 to 15 milliliters. That's, what, a tablespoon at most? Just a tiny, tiny amount that keeps everything working perfectly. Now, the trouble starts when that amount creeps up past 25 milliliters. I know, it doesn't sound like a huge jump, but it's a massive red flag. It means the system is failing. Either too much fluid is flooding in, or the drainage system is clogged up and can't get it out fast enough. And get this. This is where it gets really serious. That fluid can build up from just a tablespoon to several liters. I mean, can you even imagine several liters of fluid putting immense pressure on your lungs, literally squeezing them and making it incredibly difficult to breathe? So the big question is, why? Why does this imbalance happen? Well, it turns out there are basically two main reasons fluid can build up, and figuring out which one it is, that's absolutely critical for treatment. Okay, so on one side, you've got what's called transudative effusion. Think of this like a plumbing problem. There's a pressure issue somewhere else in the body that's forcing this thin, watery fluid out of the blood vessels. Then on the other side, you have exudative effusion. This is more like an alarm system going off. It's a response to inflammation or infection. So the fluid is thicker, it's full of proteins and white blood cells rushing to the scene. And this distinction is so important because it tells doctors where to look for the real problem. That watery transudative fluid, it usually points to a bigger system-wide issue, like heart failure or problems with the liver or kidneys. But the thicker exudative stuff, that's a huge clue that the problem is local. Think lung cancer, pneumonia, or some other infection. You see, the effusion isn't the disease. It's a giant flashing sign pointing to something else. Okay, so we've covered the what and the why. Now let's talk about the how. How does this actually feel for a patient? What are the signs to look for? Well, the number one thing people experience is just feeling more and more short of breath. It makes sense, right? As that fluid builds up, there's less and less room for your lungs to expand, so you end up breathing faster to try and compensate. A nagging cough is also pretty common, and sometimes you might get this sharp pain in your chest, especially when you take a deep breath. How bad it all feels really depends on just how much fluid is in there. And a physical exam can reveal some really key clues. You know how a doctor sometimes taps on your chest? Well, a healthy lung sounds kind of hollow, like a drum. But when there's fluid there, the sound is just dull. And when they're listening with a stethoscope, instead of hearing that clear whoosh of air, it sounds all muffled, or maybe even completely silent, blocked by that layer of liquid. So those physical signs are a really good start. But to be 100% sure and to really figure out what's going on, doctors need to look inside the body and analyze the fluid itself. The process usually starts with imaging, like a chest x-ray or a CT scan, just to confirm, yep, there's fluid. Then comes the really critical step, a thoracentesis. That's where a needle is used to draw out a sample of the fluid. And analyzing that sample, that's the holy grail. It tells them if it's the watery type or the inflammatory type, which, as we now know, points them right toward the root cause. This brings us to the most important part. How do you fix it? And the approach here really highlights a core principle of how doctors tackle these complex conditions. This sentence right here sums it all up. You have to treat the cause. I mean, sure, you can drain the fluid, but if you don't fix what's causing it to build up in the first place, it's just going to come right back. The fluid is the symptom. The underlying disorder is the disease. So the treatment is totally tailored to the cause. If heart failure is causing the fluid buildup, diuretics are often used to help the body get rid of that excess fluid. If a bacterial infection is the bad guy, then you hit it with antibiotics. The treatment path is always determined by that root cause. But while doctors are working on fixing that underlying cause, they also have to manage the immediate problem, especially if someone is really struggling to breathe. In those cases, draining the fluid can provide just immediate, significant relief. This is done with that same procedure we talked about, a therapeutic thoracentesis. They'll use imaging like an ultrasound to find the perfect spot, carefully insert a needle into the pleural space, and drain out that excess fluid. For patients, the relief can be almost immediate as that terrible pressure on their lungs is finally released. For those really stubborn cases where the fluid just keeps coming back, there is a more permanent solution called pleurodesis. It's actually pretty clever. An irritant, like talc, is put into the pleural space. This causes some inflammation that makes the two layers stick together, almost like gluing them shut. It effectively eliminates the space, so fluid just can't collect there anymore. When you step back and look at it, the story of pleural effusion is a perfect example of why medicine focuses on finding the root cause, not just treating the symptom. It's a powerful reminder that no part of the body works in isolation. A problem in the chest might actually be telling a story about the heart, the liver, or the entire immune system. It's a real lesson in seeing the body as the complex, interconnected system it truly is.